Sunday, October 23rd, meet us at Market Street in Viera for the Black and White Brunch and Art Auction, benefiting Helping Seniors of Brevard County. There's an exquisite brunch, a silent auction including oriental rugs, fine art, sports and space memorabilia, and our live auction featuring paintings and jewelry, and our beautiful Win the Jaguar 1992 XJS. All proceeds supporting Helping Seniors of Brevard. Call 473-7770 for information or visit helpingseniorsofbrevard.org. Dave Ramsey, weekdays 2 to 5 p.m. on AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Hello, everyone. Welcome to Helping Seniors of Brevard, the radio arm of Helping Seniors of Brevard. My name is Kay Kaiser. I'm the information specialist. I'm sitting in for our president, founder, Mr. Joe Steckler. And I want to remind everyone that Helping Seniors is all about helping seniors and the caretakers. I personally take the incoming calls and will try to put my callers in touch with various resources that they may be looking for. And 9 times out of 10, I discover that caller may have called for one resource they're looking for, but it could be several. So our mission is to improve the quality of life for seniors, but by providing information, education, and access to resources. So it's all about finding out where to go, who to turn to, legal, financial, housing, transportation, you name it. The list goes on and on and on and on, because many seniors, unfortunately, do not have access to a computer. They can't go online, or if they do, they may go to the library and only have a certain amount of time that they can be on that computer to find out various resources there. So we try to take the guesswork out of it and provide trustworthy, incredible professional resources that can help the seniors that call. So before we get into today's program, I'd like to thank a partial list of our partners that help make this program possible. Let's start out with Aldea Today, Barbara McIntyre, who specializes in reverse mortgage, Barefoot Bay Tatler. We just picked that up recently, and boy, we're starting to really generate a lot of calls from that southern part of Brevard County. Brevard Chiropractic and Injury Center, and that's our guest today, Dr. Timothy Bortz, and we have Neurogenics Nerve Center of Rockledge, which he's also involved in. Canadian Meds of Melbourne, Cobblestone Real Estate, which is the Waters, Courtney and Braswell Financial Group, Ebony News Today, Ear Care, Handy Pro of the Space Coast. Don't let that name get you confused. This gal actually has recently achieved her general contractor's license, and what they do is they go and help modify a senior or disabled individual to make sure that their home is safe. And of course, seniors tend to want to be able to stay in their home as long as they can and age with dignity. So Handy Pro the Space Coast is a great resource to help make that home a lot more safe. Hometown News, In-Home Personal Services, Kindred at Home, Levin Home Care Nurse Registry. So we'll pick up on our second half of our program, the rest of the partners that make this program possible. But before we get into anything else, I want to cordially invite our guest today, Dr. Timothy Bortz. Welcome to the program.
Thanks, Kay. Thanks for having me.
Well, you are so welcome. Now, you have, as I mentioned, as I was going down the list, we're going to talk about chiropractic today, okay? And maybe perhaps kind of keying in, how it can help seniors and so forth. Sure. I know as a chiropractor, you probably take all ages, is that correct?
Correct, yes.
Okay. I want to start maybe with the basics here, if I can, Dr. Bortz. Mm-hmm. You've been practicing for how long?
About 14 years now.
About 14. How did you happen to decide that you wanted to become a chiropractor?
Actually, when my father, I was working, obviously years ago, and my father had hurt his back. Uh-oh. And I was able to take him to his chiropractor, and I saw what it did for him, so I decided to go into chiropractic.
Oh, very interesting. So you had a first-hand experience with your father. Yeah. Wow. So How much time did it take for your father to, and treatments to really get, well in that result?
From what he had a lower back injury actually, and it probably took him a couple weeks to get fully recovered from what he had, that specific incident.
Okay. I would bet to venture that the number one reason people come to you is probably lower back.
Correct, yes.
Okay. And, is it probably the majority of the patients, is it because of an injury, or is it just because maybe they've got compression on their spine, or maybe you could help the listening audience understand that a little bit better?
Yeah, normally people, like you had said, the majority of patients come in with lower back pain, or neck pain is also a common one. And that can be due to many different causes. Injuries, whether it be just from simply bending over to try to pick something up, or a slip and fall injury, or auto accidents, stuff like that. So a variety of different reasons can cause lower back injuries as well as neck injuries.
Do you find that people seem to procrastinate getting to a person of your profession?
Yeah.
Then they should really be looking at getting this, looked at pretty quickly, I would think.
Normally, especially with some of the male patients that come in, they have the incident and they say they waited it out to see if it would get better, and then it doesn't get better, and then they come in. Correct.
They're too proud to admit that they really need some help is the bottom line. Okay. Well, the name of your company is called Brevard Chiropractic and Injury Center, and you're located on Rockledge. You want to give out your address where you're located?
Yeah, it's 3260 Morrell Road, and we're Suite 101.
Okay.
And we are located at the corner of Gus Hip and Morrell, right next to the Launch Credit Union, right next door.
Oh, that's easy to find. And let's give our listening audience, how can they reach you? What's your telephone number?
Our phone number is 321-631-1100.
Okay. That was 631-1100.
Yep.
Correct? Okay. Well, we're listening to Dr. Timothy Bortz here, who is a chiropractor, and for a lot of people that are not familiar with what a chiropractor is, I think Dr. Timothy Bortz, let's explain.
Sure.
Okay.
Chiropractic is based on the science or the idea that joints should be in the correct position, and they're held in the correct position by ligaments and muscles. And when those joints shift out of position, it stretches those ligaments and muscles, causing pain in the area.
Okay.
Now, if the joints in the back become misaligned enough, it can put pressure on nerves that come out from in between those joints. And when you have pressure on nerves, you feel pain, numbness, or tingling to wherever those nerves go to. So our job as chiropractors is to find where the joints are misaligned or not moving properly and adjust them to push them back into the correct position. And when we do that, we take pressure off of the ligaments and the muscles, relieving pain in the area, and we take pressure off of the nerves, which reduces the symptoms of pain, numbness, or tingling to wherever those nerves go to.
So if a patient came to you, Dr. Bortz, for the very first time, what would be the procedure? Do you take an X-ray initially, or if you could explain that a little bit?
Yeah, first we do a consultation, so we can sit down with the patients and discuss what their problems are, what their needs are.
Okay.
And then obviously we do a full clinical examination on them. Then we also take x-rays. The reason why we take x-rays is to see what's going on underneath the skin.
Okay.
Although I can feel where joints are misaligned or not moving properly, the x-ray can see underneath the skin to see if there's any arthritis, any bone spurs, anything like that that I should be concerned about before I start adjusting the joints.
Okay, so the x-ray can actually pick up arthritis then?
Correct, yes.
Interesting. Well, that's something that I know with seniors who are listening to this program today, that it seems to be a pretty common ailment, arthritis.
Correct. Yes.
How does arthritis actually form, Dr. Bortz?
There's many different ways for it. One of the most common forms, have you ever heard the phrase use it or lose it?
Of course, yes.
Well, if a joint is locked up for an extended period of time, and I'm talking weeks, months, even years, the bones in those joints, because those joints are not moving, will start to have extra bone deposits or arthritis in those areas.
Okay.
So what chiropractic can do is, with the adjustments, can free up those joints that are locked up and help stop the progression of any bone spurs or any arthritis that has been there.
I've always heard, and maybe I'm wrong on this, if somebody fractures or breaks their bone, that chances are pretty good that arthritis can be a result of that. Is that true or false?
If it's in the joint itself, but if it's in a long bone, then no.
Okay, but in the joint itself. Okay.
Correct, yes.
I remember, oh golly, it was more than 30 years ago, I got hit from behind and threw my neck out of place. It was actually straight instead of the natural
sure. Yeah.
curve. And so I went to physical therapy 3 times a week for an entire year. But I could always feel like when the pressure drops, I feel like I've got a built-in barometer.
Yeah.
Does that make sense? Have
Yeah.
you heard that? Is that possibly related to the pressure?
Yeah, actually in the joints, in the small joints in the back, there's a ligament that goes around the joint that forms a capsule. And so if there's damage to the area, if there's a change in barometric pressure, you can actually feel that in those joints that have been damaged. It most commonly happens to knee joints, but it has happened to other joints in the body as well.
So I was correct.
Yes.
I feel like I can be the weather lady here because I can tell when the pressure's going to drop.
Sure.
So it's not uncommon to feel that sense. All right. Well, good. I'm curious, Dr. Bortz. You being a chiropractor, are you considered a doctor?
Correct. We are a doctor of chiropractic.
Okay. And after having a 4-year bachelor degree, how many more years is it that you need to, you've gone to, become qualified?
It's another 4 years after that, so 8 years total.
Okay. Well, if you just tuned in, my name is Kay Kaiser. I'm sitting in for Joe Stegler today, and we're talking to Dr. Timothy Bortz, a chiropractor who owns Brevard Chiropractic and Injury Center located in Rockledge, Florida. A lot of people say, well, as you admitted here a little earlier, a lot of the guys tend to wait longer than the ladies to get, some attention to maybe that lower back pain or whatever may be suffering from. How can you explain to a fellow out there why it's important not to ignore that?
That's a good question.
Yeah.
When you have an injury, our bodies can heal most injuries.
Right.
But if an injury is still there after 24, 48 hours, that's when you should seek some help. Because maybe there's something more going on that you don't think or don't know about that's in there. And that's what us trained professionals are trained to look for and able to help you with.
And that's why you take x-rays too.
Correct. Yeah, we do the examination and also the x-rays to see what's going on underneath the skin.
Okay. Just as a first-time patient, do they need a referral from their primary physician to come see you at all?
Nope, not at all. They can come right in and we can see them.
Okay. All right. I was listening to a friend of mine talk the other day who was married to a chiropractor, and she was telling me that she couldn't believe 1 week her and her husband saw over 560 patients. Whoa! I said, is this an assembly line or something? I don't know how that they did it, but they must have worked around the clock to do that. But why? I've always heard, and I remember taking my mother to a chiropractor years ago, and she was saying, I heard this popping sound. What's that all about?
In the joints in the back, there's a ligament that goes around the joints in the back that forms a capsule.
Okay.
So when those joints become misaligned, there's a buildup of gas in those joints. So when we adjust the joints back into the correct position, that gas is released, and that's where that popping noise comes from. It's not from bone-on-bone rubbing. It's the release of gas in the capsular joint in the back.
I would have never thought of that. Because a lot of people think, oh my gosh, I'm hearing a popping sound. Are you breaking my bone or something? But that's actually the gas that's encapsulated.
Yep.
I never knew that. Well, I learned something today. Well, Dr. Timothy Bortz, how do people get a hold of you here again? Let's give your number.
The phone number at the clinic again is 321-631-1100.
Okay, that's a really easy number to remember. And in case you didn't get it down the first or second time here, you can always call Helping Seniors of Brevard at 321-473-7770. So if I'm not answering the phone, by all means leave a message because I'm doing the radio show right now. So those callers coming in, we back everything up on 3 separate computers, so a call is always returned. So again, Helping Seniors of Brevard number is 473-7770. Okay, what other services do you offer at Brevard Chiropractic and Injury Center?
Well, we happen to have not only on-site x-ray, but we also have non-surgical spinal decompression, which is a non-surgical treatment for either disc herniations in the neck or in the back.
Hold on, let's explain
Sure.
how that works,
Sure.
because I just learned something about the popping sound and all that. What would a patient expect, when they have that type of treatment?
Well, non-surgical spinal decompression, again, is a non-surgical treatment for either disc bulges, protrusions, or herniations in the neck or in the back. And what the device does is it gently pulls those joints basically slowly apart and tractions out those joints. Because the actual discs are connected to the bones above and below in the vertebra in the back, that negative pressure there creates a kind of a pulling action on anything that's bulging or sticking out.
Huh.
Think of a tube of toothpaste. You ever taken
Okay.
your hand off a tube of toothpaste and the toothpaste kind of gets sucked back in?
Right.
Same concept for disc problems. That's
Oh,
what this device
interesting.
does. So it's a
Okay.
non-surgical treatment for disc problems.
So is it something they lay down on?
Correct.
In this
They're-
case?
Correct. They're laying down on a table, face up,
Okay.
and there's a belt that goes across their waist and one that
Okay.
goes across their chest, and it just gently tractions out those joints in the back.
Okay. So how long does that procedure generally take?
It's about 18 to 20 minutes, and then afterwards we put you on some therapy for the back, so it's probably a total of maybe 30 to 35 minutes.
Okay. Do people fear that kind of treatment for the first time?
No, not decompression, no. The majority of the patients that have never been to a chiropractor are a little bit kind of freaked out about the neck adjustments, but
Yeah.
after a couple adjustments they're fine.
Yeah, that always had to
Yeah.
make that quick movement in the neck. I've had that done before. It seemed like, wait a minute, I wasn't expecting that. I think it's just the fact that you just didn't expect it to begin with. So, what about other services might you offer in your clinic?
We also have a massage therapist on hand, so we do massage therapy as well.
Okay.
And then we have ultrasound. Ultrasound uses sound energy to penetrate the skin and help speed up healing in the soft tissue.
Ah, okay.
We have a hydrotherapy bed, it's kind of like a water bed that has jets on the inside that spray up and it massages you. You do not get wet. You're fully clothed, but you lay on the bed and it massages the muscles in the back.
Oh, wow.
Then we have
Well, that sounds interesting.
yeah.
That sounds relaxing,
we've had
actually.
almost no complaints about that table.
I bet. I bet.
We also have an intersegmental traction table, which is called a roller table.
Uh-huh.
You lay face up on it, and it kind of pushes up on your back, and it rolls up and down your back. Kind of gets those joints moving all the way up and down your back as well.
Oh, okay. Well, you mentioned you have a massage therapist
Correct.
in your clinic. Is there a specific type of massage that he or she specializes in?
He does all types of massages. He's been with me for 8 years now.
Okay.
It's very good. He knows everything. He's very good.
Okay, so it could be Swedish, it could
Yes.
be...
A hot stone massage, yeah.
Yeah, all the different type. Well, that always is good for your circulation.
Yes.
For sure. My neighbor across the street is a licensed masseuse, and she's into very much that and acupuncture. And, a lot of people, I think, and you might agree with this or may not, but believe that the body has an innate ability to regenerate itself.
Correct. That's what basically chiropractic is based on. The body's
Okay.
own innate ability to heal itself. And if you just take away any stresses or anything that's hindering that, then the body can heal itself.
Okay. Well, I've always been a firm believer in that, and that's why I remembered that, as far as, guys, just don't wait as long as, right?
Correct.
Yeah. All right. Well, so it's really interesting because a lot of people think, oh, well, it's just going to go away, and then I wake up the next day, and that pain's still there, and...
Yeah. And then I'll have patients say, oh, this pain, I've had that for years.
Ooh.
And I tell patients, you shouldn't have pain for years. So,
Yes, correct. And I guess the first question I would say is, why live in pain,
Correct, yep.
If there's something that you can possibly do to help that. And just give your body a chance to heal itself, and you just kind of speed up that process. Correct?
Correct.
Okay. Well, we're listening to Dr. Timothy Bortz here today on the Helping Seniors of Brevard radio arm. And his company is called Brevard Chiropractic and Injury Center, located in Rockledge, Florida. So we're going to get ready for a couple minutes here to take our first break. But before we do, I want to kind of recap, Dr. Bortz, what we've talked about in the first half, if we may. If you could sum up, for our listening audience, the importance of seeing a chiropractor. Why don't you share that information once more?
Sure. Chiropractic can help with joints that are locked up or misaligned or not moving properly.
Okay.
If those joints sit misaligned for an extended period of time, weeks, months, years, arthritis or degeneration can set in. And when those joints become misaligned, it stretches ligaments and muscles, causing pain in the area.
Okay.
If they're misaligned enough, it can put pressure on nerves, causing pain, numbness, or tingling to wherever those nerves go to.
Right.
So the chiropractic adjustment can push those joints back into the correct position, take pressure off of the nerves,
Okay.
take pressure off the ligaments and the muscles, so it relieves the symptoms of pain, numbness, or tingling, and also pain in the area of the adjustment. And it can also help stop the progression of any degeneration or arthritis that might be there.
So you mentioned the word degeneration now, and
Correct.
that if people procrastinate in trying to take care of the problem that solves, to try to resolve the pain, and like you say, the alignment and the ligaments and so forth, it can actually get worse before it gets better,
Correct, yeah.
right? Well, we've got less than a minute here. Dr. Timothy Bortz is who we're talking today on the radio arm of Helping Seniors of Brevard, and he has his company is called Brevard Chiropractic and Injury Center, located in Rockledge, Florida. So let's give your number out here one more time before we take our first initial break.
Yeah, our number at the clinic is 321-631-1100.
Okay, very good. And if you missed it, just call Helping Seniors of Brevard at 473-7770. So we're going to get ready to take a quick break. We'll be back. Stay tuned because we've got a lot more information that we're excited to share with our listening to audience today. So stay tuned. We'll be back with you very shortly.
Nominated Business of the Year by the Cocoa Beach Regional Chamber of Commerce. This is AM 1060 WMEL. Sunday, October 23rd, meet us at Market Street in Vieira for the Black and White Brunch and Art Auction, benefiting Helping Seniors of Brevard County. There's an exquisite brunch, a silent auction including oriental rugs, fine art, sports and space memorabilia, and our live auction featuring paintings and jewelry, and our beautiful Win the Jaguar 1992 XJS. All proceeds supporting Helping Seniors of Brevard. Call 473-7770 for information or visit helpingseniorsofbrevard.org.
Welcome back to the second part of Helping Seniors of Brevard, the radio arm of Helping Seniors of Brevard. My name is Kay Kaiser. I'm the information specialist for Helping Seniors of Brevard, sitting in for Mr. Joe Steckler, our president and founder. But before we get into our second half, as far as talking with Dr. Timothy Bortz here today, I'd like to thank a list of other sponsors that make this program possible. Let's start out with Organized Creative Designs. What's that? This lady, Carla Pickrell, who's an RN, was her background. She will go in and help seniors get organized. And it could be anything from just, scaling down a little bit, going into bookkeeping, just going through things and getting life organized. That's so important. So we're happy to have her part of our partners as listed as well. We also want to thank Riverview Senior Resort, Senior Scene Magazine. We have an 8-page newsletter in that magazine each and every month, and it's a pull-out section. And believe me, I think people really do keep a hold of that, because I was telling Joe the other day that the amount of calls that we've taken in is enormous. But many of those people that are continuing to call back could be from even a couple years ago. So I kind of jokingly just say they must keep her number on the refrigerator on a magnet or something. So, but it's all good because we're here to help. Seniors Helping Seniors, Dr. Lee Sheldon, DMD, Spotlight Magazine, the Eye Institute, the Fountains of Melbourne, Veterans Realty of Brevard. If you're looking for a real estate broker, agent, they give a special discount to seniors and veterans. Vitas Innovative Hospice Care of Brevard, Watercrest Senior Living Group, which is the Market Street Memory Care Residence, getting ready to open up the latter part of October. And if you listened in right before our program started here today, we are having a huge fundraising event at Market Street Residence on October 23rd. It will be it's called a black and white art brunch, basically. It's going to be served from 11 to 2, but you'll have an opportunity to bid on various items, oriental rugs, artwork, sports and space memorabilia, and there'll be a silent auction as well. But we'll have our 1992 Jaguar featured and showcased there, and you can buy raffle tickets for that car. Imagine driving around in a ruby red, low mileage 1992 XJS Jaguar. Wow, everybody's going to be turning their heads on that one. So mark your calendar for that. That's coming up in the not too distant future. We also want to thank William Johnson. He's a board-certified elder law attorney. And of course, hats off especially Mr. John Harper, WMEL 1060 Radio, which makes this all possible. Wusthof Health System and Zahn Beachside Assisted Living. So welcome back to our second portion of Helping Seniors of Brevard Radio Arm today. My name is Kay Kaiser, sitting in for Joe Steckler. And I want to reintroduce our special guest today, Dr. Timothy Bortz. Welcome again.
Thanks, Kay. Thanks for having me.
Okay. Dr. Bortz, your name of your company is called?
Brevard Chiropractic and Injury Center.
Okay, and you're located in Rockledge.
Correct.
And if people want to get a hold of you, what number can they reach you at?
Our phone number is 321-631-1100.
Okay, super duper. Well, if you just tuned in, Dr. Bortz did an excellent job in explaining what chiropractic care is all about. But we kind of left off before we took our first break. The fact is that, and he agrees with me, if you don't use it, you lose it. But also the other saying is the body has its innate ability to regenerate.
Right, to regenerate, to heal itself.
To heal itself, and that's extremely important. So a lot of people out there think, well, I've lived with this pain, I'll just wake up and I'll have it again tomorrow, so they kind of get used to it, or maybe they have some kind of take an aspirin or a Tylenol or something and think it's just going to go away. But that's not always the case, is it, Dr. Bortz?
Correct. There are some times that some problems that present themselves won't go away without seeing a chiropractor, because the joints that become misaligned, your body kind of gets used to it, so joints above that problem or below the problem will compensate for it. So then if the joints are locked up for years, that's when arthritis and stuff like that set in. Degeneration. Yeah, well, arthritis. We just heard a popping sound. Yeah. We talked about that too. And let's refresh our listening audience the fact that what they're actually hearing in that popping sound. Explain that again, because I find that very fascinating. Sure. In the joints in the back, in the vertebrae, there's actually a ligament that goes around the joints that forms a capsule. Okay. So when those joints become misaligned, there's a buildup of gas in those joints. So when chiropractors adjust those joints, that popping noise is the release of gas out of that capsule. It is not bone on bone. It's not bone rubbing on bone. It's just a release of gas. That's what that popping noise comes from. And I never knew that before I had you on the air today, because I heard popping sounds when my mother used to get treatments and so forth. So it's very common to be able to hear that, correct? Okay, so we've got a new patient that's going to come see you. But before they do, they might want to know, how do you take any insurance plans and so forth? Could you explain that to our listening audience? We do accept Medicare and Medicaid, as well as some health insurance plans in the area. Okay. Now, with the Medicare insurance, Medicare will cover the cost of the adjustment, and I think there might be a couple dollar copay with that, depending on the number of segments that we adjust. Okay. The exam and X-rays, unfortunately, are not covered by Medicare. That would be an out-of-pocket expense. Okay. So basically, it's just the exam that the Medicare would cover. Would not cover, correct, exam and X-rays. Okay. I wanted to make sure that was really understood. So it's just, how about Medicaid? Medicaid actually does cover the cost of exam and X-rays and adjustments. Well, covers some of it. Okay, not 100% though, in most cases. So, there's a big difference between Medicare and Medicaid. Correct. So a lot of people think, oh, well, my Medicare's, I'm not on Medicaid, and that's going to just take care of everything, and that's not entirely true. Correct. Okay. Just wanted to try to bring that to our listening audience attention there, because, they think that a lot of things are covered, but they're not necessarily all covered. So, it's always good to try to plan ahead, obviously. Yep. Let's talk about why chiropractic care is important for seniors, Dr. Bortz. Sure. As we unfortunately age, and everybody ages. Correct. Unfortunately. The joints in not only in our back, but joints throughout our body can, should say, essentially deteriorate, degenerate. Okay.
Mm-hmm. Right.
And the old adage of use it or lose it.
Mm-hmm.
If a joint, especially the joints in our back, are locked up or not moving for an extended period of time, degeneration or arthritis sets in.
Mm-hmm.
So what chiropractors do is we look for joints that are misaligned or not moving properly, and we adjust them so that any arthritis that's there, we can help stop the progression of it so
Mm-hmm.
it doesn't get worse, or help to stop the progression of arthritis before it even starts.
Okay, well, that's very important. And if you were to say, what health concerns do most seniors have when they first visit your office?
It's pain, back pain, neck pain.
Okay, it's the same. It's
Yeah.
the same pretty much symptoms. Okay.
Mm-hmm.
You know, many seniors, and you've seen them, particularly women, who have, they're using their rollator or their walker or their cane or whatever, but they're slunched over, and now they've got osteoporosis. So how can chiropractic care perhaps benefit for a woman even prior to having osteoporosis or with it?
Sure. There are different types of adjustments that we can do even with patients with osteoporosis. Obviously, you have to be careful with the adjustments that you do.
Right.
But we do have what's called an activator. It's a little device that delivers a little bit of an impulse to the joints to get those joints to move, where
Okay.
we don't have to use our hands to push the joints to get that popping noise. So we can get movement in the joints that is more safe for patients that have osteoporosis.
Okay, well, that's interesting because I know that, there hasn't been anybody I have known that's never seen someone who does have that rounded back. I remember my poor grandmother had it so badly. And, it's kind of like she had to look up in order to see, just because she was so slunched over. So it's a shame, and unfortunately, a lot of women experience that.
And if you can get in and get adjusted years before that, then you could potentially never have that develop because those joints are pushed into the correct position, adjusted into the correct position.
It's one thing that I try to practice, Dr. Bortz, is good posture.
Sure.
And so many of seniors, especially once they retire, they're sitting in that lazy boy chair, maybe just watching TV all the day, and here goes that, posture, and so now all of a sudden they get up, their back hurts.
Yeah.
They're sitting
Too long.
They're sitting too long. So, if a senior comes to you and says, I'm fine, and then you start to notice, wait a minute, these are some things that we should be taking a look at.
Right, and
Dr.
we'll
Bortz?
pick that stuff up on the examination and or also the x-rays.
Okay. So you brought in a very important point regarding the osteoporosis situation, is that it possibly could be prevented if properly. Go ahead.
I was going to say chiropractic can't prevent osteoporosis.
Okay.
It can potentially help with, how should I say this?
Further degeneration, perhaps?
Yeah, further degeneration in the
Okay.
joints,
Okay.
which can potentially cause other problems, other issues.
Okay.
But
Okay.
chiropractic can't help with osteoporosis, can't prevent osteoporosis.
Okay. I wanted to clarify that.
Yeah.
Okay, just in case people didn't quite get that, on our discussion here, Dr.
Sure.
Bortz. So, if a senior is really just walking with a cane, and they really should use a rollator or walker, because many cases, as you know from seniors, the number one issue is probably falls, right? Do you see a lot of patients that have experienced falls?
Oh, sure,
and now?
yeah. And yet, there's many different reasons for why a person might fall. For what we deal with is if the joints are misaligned and locked up, not moving properly, then there's decreased range of motion.
Oh,
So
okay.
if you can adjust those joints, get movement in there, and increase the range of motion, then it's easier for patients to get around.
Okay. Well, Dr. Bortz, it's a very important issue, too, because often as people age, they lose their balance and their coordination. So back to that use it or lose it, it's important for seniors to stay active as long
Correct.
as you can, because things kind of tighten up, I think, right? And therefore they get painful. They have trouble maybe even getting up out of a chair, so without assistance. So I think it's very important that people understand the value of good chiropractic care. So if you were to say, no matter, if you have the first onset of pain that you think you're suspicious of, right, Dr. Bortz?
And one thing to keep in mind too is you can have joints that are misaligned or not moving properly and not necessarily have perceived pain. So you can have a problem set in that might be there for years on end, and you think you're perfectly fine. But if you come into a chiropractor and we do an examination on you and x-rays, we can pick up on these areas that are misaligned, not moving properly, maybe already have some arthritis developed in there, but you had no idea of it. So we can pick up things that you might not know there's a problem there and might not even have a problem for another year or two, but we can help you with that before it becomes a problem.
Okay, that's a very interesting point, Dr. Bortz. Well, you're listening. My name is Kay Kaiser. I'm sitting in for Mr. Joe Steckler today, our president, founder, and our guest is Dr. Timothy Bortz, who has Brevard Chiropractic and Injury Center located in Rockledge, Florida. Well, let's kind of get into, because a lot of people think about going to chiropractors after they've been in a car accident, correct?
Yes.
Okay. And maybe they've had a case of, like I was describing with my own neck and so forth, a case of whiplash, or how would you go about advising those people?
When a patient comes in that's been in an auto accident, we also obviously do examine x-rays on them, make sure everything's fine. We focus a lot on rehabilitation, strengthening tissue that's been damaged back to what it was before the accident. When tissue's been damaged, if you don't rehab it properly, then scar tissue can form. Now, scar tissue is not as elastic as normal tissue, and then what happens is down the road, months and years later, you have decreased range of motion and chronic pain in the tissue because it wasn't rehabbed properly.
Ouch!
So not only do we do the chiropractic on those patients, but we also focus on rehabilitation to get that tissue back to what it was before the accident.
Oh, that's very fascinating. So that we know that scar tissue is not as elastic as a regular tissue prior to an accident and so forth. So it's always advisable, if anybody really has had an accident, don't delay.
Correct.
Don't delay.
Yeah, and one thing to keep in mind, in the state of Florida, you have 14 days to seek treatment under your auto insurance for an auto accident. Otherwise, you won't have coverage under your own auto insurance.
Okay, let's explain that again. So people who procrastinate are not going to be benefiting with their insurance situation.
Yep, they have 14 days to seek treatment to get coverage under your own auto insurance for an accident.
So it's very important to get treatment as soon as possible.
Correct, yes.
And again, the longer you wait, the more that's going to degenerate. So kind of to sum it up there. Well, Dr. Bortz, what about, do you work with any local attorneys regarding auto accidents and so forth?
Yeah, if a person's been involved in an accident, we work with almost all the local attorneys to help get the patients the legal necessity that they need for any injuries that they might have from the accidents. And it's hard to say whether or not a person that comes in will need an attorney. It's always advisable to talk to an attorney because they don't charge for consultations.
Right.
And let them deal with what they have to deal with over there.
Okay, well that's important too. So you have a network of attorneys that you work with and so forth. You see all these ads on television all the time, auto accident, the best, and flashing up, you've won $500,000, etc. Oh, geez. Used to be that they couldn't advertise before, but now they're taking over the airways.
Yeah. And you never know. You might be in an accident, and at the end of treatment, if you still got any problems or complaints, that's why you have an attorney, because you've been damaged or injured from this accident that wasn't your fault.
Right,
That's why you have an attorney, just to protect yourself.
Oh, absolutely. Let's go back a moment here, Dr. Bortz, and talk about this non-surgical spinal decompression. Explain how that works to our listening audience again, if you wouldn't mind.
Sure. In our backs, we have a disc, and that disc is between the vertebrae, the bones in our back. That disc has a center nucleus. Think of a jelly donut. If you squish a jelly donut and jelly comes out the side, that's kind of like a herniation in your back. So what non-surgical spinal decompression does is it stretches or pulls those joints apart. And because those discs are connected to the bones above and below, when you pull that joint apart, that negative pressure causes anything that's bulging or sticking out to get pulled or sucked back in.
Well, I'm telling you, if you were on TV and your demonstration here, you need to talk with your hands and
Yeah.
so forth. But I'm sure that we're going to make sure that we do that on TV and bring your models here as
Yep.
well. So, it's interesting because I wish you could see how he was explaining this, and it was very visual as well. So I had to make a comment on that,
Yeah.
Dr. Bortz. Well, you're listening to Dr. Timothy Bortz, who has Brevard Chiropractic and Injury Center in Rockledge, and if people didn't get your number in the first or the second part, let's shout it out again, okay?
The phone number at the clinic is 321-631-1100.
Okay, perfect.
And our website is brevardchiro.com.
Oh,
That's
good.
Brevard, CHIRO.com.
All right. And for those who didn't get all that, if you can always call Helping Seniors of Brevard at 321-473-7770 and go to our website here too, helpingseniors.brevard.org, because literally everything we do, the radio show, our television programs, our print, all of our outreach media, it's all archived on our website. So probably in a couple days, this particular show will be up on helpingseniors.brevard.org. So I think that we've had an interesting conversation, and I've learned a lot from Dr. Bortz here today. And I want to take a moment. Is there anything last? We have about 30 seconds left that you would like to add to the program today, Dr. Bortz?
Look us up online at brevardchiro.com or give us a call, 631-1100.
Okay, perfect. Well, I want to thank you so much for being our guest
Oh, you're
on
welcome.
our Helping
It's a pleasure
Seniors.
being here.
Oh, fantastic. We're going to have you back again.
Great.
All right. Thanks a lot for listening, and we'll be back next Thursday at 1 p.m. on AM 1060 WMEL. Thanks for listening today.